Imagine you're on call. It's the middle of the night, and a 60-year-old man presents with a severe cough, splattering bright red blood onto the tissue. He's visibly anxious, clutching his chest. You know you're looking at a classic case of hemoptysis. Hemoptysis, as defined, is the expectoration of blood or bloody sputum. But it's crucial to understand the types and causes to guide diagnosis and management effectively. Let's start with the types. First, there's frank hemoptysis, where the patient coughs up blood alone, no mucus mixed in. This type is often severe, and if persistent, it might suggest bronchogenic carcinoma, something we need to investigate seriously. Then there's hemoptysis in suppurative lung disease, like bronchiectasis or lung abscess, where large quantities of foul-smelling, blood-streaked sputum are produced. We also encounter spurious hemoptysis, which stems from an infection in the upper respiratory tract above the larynx. And then there's pseudohemoptysis, where red-colored sputum is actually due to pigments, often from Serratia marcescens infection. Finally, a rarer type, endemic hemoptysis, occurs with lung fluke infections, like Paragonimus westermanni, which is seen in specific geographic areas. Now, understanding severity is crucial for immediate management. Hemoptysis can range from mild, with less than 100 milliliters of blood loss per day, to massive, where blood loss exceeds 500 milliliters daily or 150 milliliters per hour. For these severe cases, aggressive interventions like rigid bronchoscopy or even surgery might be required to control bleeding and prevent fatal outcomes. Hemoptysis isn't a diagnosis on its own, it's a symptom with a broad differential. The most common cause? Infection. Tuberculosis, lung abscess, bronchiectasis, and pneumonia are high on the list, alongside fungal infections like aspergillosis and nocardiosis. Other causes include neoplasms, notably bronchogenic carcinoma and metastatic tumors. Cardiovascular conditions, such as mitral stenosis and pulmonary embolism, can also lead to hemoptysis due to increased pressure in the pulmonary vasculature. And let's not forget collagen vascular disorders like Goodpasture syndrome, which involve lung hemorrhage. Trauma, whether due to inhalation of toxic gases or iatrogenic causes like biopsy procedures, is another significant factor. And in rare cases, bleeding disorders or radiation fibrosis may play a role. Now, it's critical to differentiate hemoptysis from hematemesis, as each signals distinct pathologies. Hemoptysis is generally preceded by coughing and produces frothy, bright red blood mixed with macrophages and neutrophils. It's alkaline in pH and lacks the food particles often seen in hematemesis. Hematemesis, on the other hand, is preceded by nausea or vomiting and presents as dark brown blood due to acid reaction. It's associated with gastrointestinal issues, like peptic ulcers, and is diagnosed via gastroscopy rather than bronchoscopy. So, whether it's a mild case or a life-threatening bleed, knowing the types, causes, and distinctions of hemoptysis can make all the difference in your diagnosis and intervention. Thanks for watching, and stay tuned for more clinical insights to help you tackle complex cases with confidence. Don't forget to check out Severity for additional resources.